with the goal of distributing 300 doses of Narcan, the anti-overdose drug, in one weekend, and distributing 300 kits of the life-saving Narcan nasal spray.
Our job is to love others without stopping to inquire whether or not they are worthy. That is not our business, and in fact, it is nobody's business. What we are asked to do is to love, and this love itself will render both ourselves and our neighbors worthy. Thomas Merton. When Kyleigh and I set out on this journey, we came from different places. As a Christian, I believe that the greatest commandment came from Jesus when he said to love our neighbors as ourselves. Kyleigh doesn't come from the same place, but she still comes from a place of love. I'll let her tell you about it.
I entered this project originally from a place of curiosity. I knew little about Narcan and about substance use disorder, but I did know about the drug history of our state and our community. My inspiration for this project came from Jan Rader, our local city fire chief, advocate, and my personal hero. When I met her in February, I realized how much this project truly meant to me when I told her she was my inspiration for training people on how to use naloxone while I was on the verge of tears.
Here's a bit of background info you'll need to be familiar with. Harm reduction is any practice that reduces potential harm. Pretty self-explanatory. Dr. Sidney Smurl-McElroy defines it as any form of communication or action. It includes actions like wearing a seatbelt to reduce harm in a car crash, sunscreen to prevent sun damage, and alcohol wipes and naloxone to reduce the use of substance, or to reduce the risk of substance abuse. Narcan and naloxone are the same. Narcan is the brand name, naloxone is the generic. We were lucky enough to be able to use Narcan nasal spray.
First, I want to introduce you to some of West Virginia's historical data when it comes to overdoses. West Virginia has led the number of overdose deaths from 1999 to 2019. The second-ranked state wasn't even close. West Virginia's death toll was over 25% higher than the second-ranked state, and more than 10,000 people died. Fortunately, there may be some justice. On April 4th of this year, a trial involving the opioid makers Janssen, Teva, and Allergan ensued. Attorney General Patrick Morrissey says they fueled the opioid epidemic by deceiving prescribers, and the opioid makers, quote, participated in a highly sophisticated scheme to mislead healthcare providers and consumers about the addictive nature of their products. That trial and many of the other overdose deaths in West Virginia are caused by overprescription. According to the Centers for Disease Control and Prevention, 20% of patients with non-cancer pain symptoms received a prescription for opioids. In 2012, healthcare providers wrote 259 million prescriptions for opioid pain medication. That is enough opioids for every single adult in the United States to have 2 bottles of pills. Fortunately, when prescribing opioid pain medication, there is a way to decrease the number of overdose deaths. The CDC recommends co-prescription. When naloxone is co-prescribed with prescription opioids, the risk of overdose decreases, even when that naloxone prescription does not get filled, showing that education about naloxone and overdoses does a lot to prevent them. Huntington is often called the overdose capital of the nation. Huntington's overdose rate is over 10 times the national average. Many heroin addicts start on prescription painkillers they got from a legitimate injury, but when they get addicted to pills and they no longer have access to those pills, they start using heroin. According to Jan Rader, 20 years ago, emergency responders would get calls about overdoses a few times a month, but now they get calls 5 to 6 times a day. And in August of 2016, there were 28 overdoses in one day. But those numbers didn't really hit home for us until we hit the streets.
Kyleigh is great at statistics, and I'm glad that she is, but I take a more storytelling approach. Meet Dr. Charles C.K. Babcock. He is the self-described naloxone guy at the Cabell Huntington Health Department. He spends 1 day a week working with people in active addiction and training them to use naloxone. His second week ever at the clinic, he had the opportunity for the first and only time to administer naloxone. When a man walked in seeking a safe place for the day, he was only there for about 5 minutes before he collapsed on the ground and fell unconscious. As it turns out, CK had just sent one of his volunteers down to get a new case of Narcan because he didn't have any. Knowing that he had some expired Narcan in his backpack, he ran and grabbed it and administered it as a nurse began basic life support. At least 5 doses of naloxone later, EMS arrived. The overdosed man refused to go with the EMS and instead came back into the health department. He went unnoticed until he got to CK's station, where CK figured out what had happened. The man had injected directly before entering because he didn't want to go into withdrawal. Unfortunately, CK was not able to be here today, but I felt it was still important for you guys to know him.
Yes, it is true that people who overdose once and survive are likely to overdose again. But it is also true that access to Narcan does not increase those numbers. Mental health and substance use diagnoses are associated with higher risk of repeat overdoses. Of the 14.9% of patients who have repeat overdose, 29% of those overdoses occur within the first 30 days of their initial overdose. And there are some risk factors associated with repeat overdose as well. Males and those with pre-initial overdose diagnoses of depression, anxiety, and alcohol use disorder are more likely to overdose. However, the risk is lower for individuals who are prescribed an opioid 90 days before their initial overdose, or admitted to the hospital for their initial overdose. According to the National Institute on Drug Abuse, a study in Massachusetts showed that rates of opioid-related emergency department visits and hospital admissions were not significantly different in communities with high or low administration of naloxone, proving that access to naloxone does not increase those numbers, and it reduces the number of overdose deaths and increases opportunities for recovery.
Now meet Christian Weaver. Born in Florida, Christian grew up with parents who were both addicts. Essentially raised by a single mother, he was taken into Child Protective Services around the age of 12. Separated from his siblings, Christian had already been suffering from mental health disorders and began dabbling in marijuana and alcohol. In and out of group homes, he fell more into his addiction and served 6 months in juvenile prison for possession. When he was sent to a therapeutic group home, he was supposed to be tested regularly. Until the end of his senior year, Christian was mostly able to stay clean. In his senior year, though, he began dabbling in opioids and pills. 1 month after his graduation, he was charged for possession of a large amount of marijuana and served about a 1-year sentence. With no reports against him, he completed his parole in Florida. He then moved to West Virginia, where he overdosed several times and went into withdrawal each time.
When an individual overdoses and they are brought back using Narcan, they go through immediate withdrawal. Symptoms of withdrawal include anxiety, nausea, diarrhea, flu-like symptoms, muscle cramps and body aches, runny nose, excessive sweating, hot and cold flashes, and trouble sleeping. For short-acting drugs like heroin and prescription painkillers, withdrawal can last an average of 4 to 10 days. For longer-acting opioids, such as methadone, withdrawal can last anywhere from 8 to 12 days. To reduce the number of overdose deaths, we have something called a drug safe haven or supervised consumption site. An SCS is similar to a bar, in which it is a place for people to use drugs safely under the supervision of a medical professional or a bartender, if we're sticking with that analogy. So not only does an SCS reduce the number of overdoses, but it can also reduce cases of HIV, hepatitis C, STIs, and other bloodborne diseases. SCSs are not common in the United States, but have been proven to be effective in other countries. In Sydney, Australia, the use of drug safe havens since 2001 have seen 5,900 overdoses with 0 deaths.
Ready to do better, Christian moved to West Virginia. When he reconnected with his father, who was cooking methamphetamine, Christian found himself using meth and heroin. When his father discovered Christian's addiction, he kicked him out. Even though his father was part of the drug community, he drew the line at heroin, something that Christian finds hypocritical and confusing. Now homeless in Huntington and Milton, Christian lived in a tent for 3 or 4 years. He attempted to stay at the mission for about a month before he was kicked out for selling heroin on mission property. At that point, recovery programs were few and far between and were only accessible to people who knew the right people. In 2014 or 2015, Christian started going to First Steps, where he reconnected with Lifehouse. This is where Christian found his first real relationships in life. He initially went to find drugs, but the staff made a connection with him. He went into First Steps one day, and he decided that he was ready to start recovery. This was Christian's first time into recovery, but he would have to return several more times. Christian's last overdose was in First Steps on January 10, 2017, where he was administered naloxone by First Steps staff and firefighters. 1 year later, Christian became the director of the Lifehouse program, the one that he went through. Now working as the Chief Officer of Operations at Huntington Addiction Wellness Center, 28-year-old Christian is a success.
People believe naloxone is an overdose enabler. They believe that when we give people Narcan, we're giving them a drug user safety net and perpetuating the cycle of addiction. However, according to a recovering drug user, Jonathan Goyer, anyone who has just overdosed isn't worried about the police or the Narcan safety net. In an interview with the Marshall Project, Goyer said, quote, "Why would anyone want to get high to the point where they would have to take Narcan and immediately sober up? The problem is that many drug addicts don't care if they live or die." There is a misunderstanding that Narcan is easy and that when it is used, there are no consequences for the person overdosing. But that is far from the truth. Narcan instantly ruins any drug high and leaves that person violently ill from brutal withdrawals. And it is no feasible way for drug users to see Narcan as a safety net with no consequences. But when we run across someone who feels the need to share their misunderstandings with us, we can either try and reason with that person or ignore it and continue our work. I think that is something for every individual trained in Narcan to decide.
Born in 1972 in Palm Springs, California, Jerome Comer had no accountability from his ailing mother. By the time he was 8, he had started to drink alcohol, and a year later had started smoking marijuana. He mimicked these from his family. By the age of 16, Jerome had dropped out of school. He tried to go back several times, but found himself making decent money as a mechanic, so there was no need. After his mother's death, Jerome fell more into addiction. Needing a geographical change, Jerome moved to North Carolina, but remained a functioning addict, able to mask his addiction. Trying another geographical change, Jerome moved to Akron, Ohio with his now ex-wife. Jerome had his first child in 2002, but began to substitute one drug for another. After several geographical changes, Jerome ended up back in West Virginia and kept using as well as selling. In 2015, Jerome was caught selling drugs and got sent to prison for 15 months, where he managed to stay clean. Having not learned the proper coping skills, however, he immediately overdosed and was rescued by naloxone when he was released from prison. Whilst on parole, Jerome was forced to pass a drug test at each visit, but he managed to continue using while still passing his drug tests, planning very carefully. After dehydrating on methamphetamines, Jerome had to sign himself out of the hospital to visit his parole officer so that he would not go back to prison. At this time, Jerome regained custody of his youngest son and moved to Charleston, West Virginia, where he balanced 2 jobs. Yet again, though, Jerome was caught high and was sent back to jail. After this, Jerome's parole officer referred him to a recovery program rather than a longer sentence. When Jerome went to Recovery Point in August of 2019, he did not buy into the program. He did not want to be there, but he preferred rehab to jail. His parole officer pushed him to wait until step 4 of the program. By the time Jerome reached step 3, he had finished his parole, but instead of falling back into addiction, he decided to continue his recovery journey. After 9 more months at Recovery Point, Jerome became a peer support mentor at the same facility to help transition into the real world. When his 3 months as a peer mentor ended, he found work at Facing Hunger Food Bank and worked for 9 more months. After working at Facing Hunger, Jerome transferred to Huntington Addiction Wellness Center as a peer support specialist. He is now reconnected with his family and has re-enrolled in school at the age of 50 to obtain his GED.
Every individual who's been arrested for substance use or possession goes to drug court, which is a court for all crimes involving the use or possession of illegal substances. A great example of drug court is in the documentary Heroin, which provides real-life examples of people in Huntington who are deeply affected by drug use and Narcan. One of the questions often asked about drug court is, should all drug court clients get naloxone as part of their recovery process? I think yes. They are all in a situation where they could overdose or witness an overdose. And the research and statistics prove that Narcan does not increase the amount of overdoses and can in fact lower them.
After an individual has been sentenced to recovery, there are several programs in which they can enroll. I'd like to highlight 3 that are prominent in our community. Provider Response Organization for Addiction Care and Treatment, or PROACT as we will call it, is a unique coalition of 3 separate entities coming together to meet a need in Huntington. It consists of Marshall Health, Cabell Huntington Hospital, and St. Mary's. They came together approximately 3 years ago. What makes PROACT so unique, though, is its emphasis on faith, having a chaplain from St. Mary's. Prestera, an organization that focuses on behavioral health, addiction recovery, and family services, is so vast it's impossible to cover all of them. So I'd like to focus on the Renaissance program. In particular, it takes all three of the aforementioned fields into consideration. Behind their main building on Route 60, Prestera owns several houses that mothers in recovery can live in with their children. This program allows mothers in recovery to maintain custody of their children, where they receive counseling, therapy, and other resources to advance in recovery. Founded by Kyleigh, Huntington Addiction Wellness Center, or HAWK, is an individualized recovery program. It consists of 3 phases, where patients move from completely inpatient to fully outpatient. Of its 21 employees, all of them are recovered addicts. Outside of recovery programs, though, harm reduction programs meet the needs that recovery programs cannot. This is where I come in. Meet SPECO, St. Peter's Episcopal Community Outreach. At SPECO, we have a blessing box, built about 5 years ago by me and my dad. We built this blessing box. It's actually the white and red one, and the brown one is our newest because it needed replacing. It offers food to those who don't have it in our community, and that's where we started. SPECO is now a full-fledged harm reduction program, and each week we distribute Narcan and a meal. For our project, Kyleigh and I partnered with SPECO to host a Save a Life Day. We set a goal of distributing 300 kits of naloxone in one day. We set up 3 locations and a mobile unit: Marshall University Student Center, Heritage Station, and St. Peter's. At Marshall, we were able to distribute 88 Narcan kits with 6 volunteers. Here, our biggest accomplishment was establishing a working connection with Marshall, which we hope to continue as we continue our education there next year.
At Heritage Station, we were able to distribute 45 kits with 5 volunteers. Here, our biggest accomplishment was getting several businesses trained in naloxone and learning that the bathroom at Heritage Station is a hotspot for overdoses.
At St. Peter's, we were able to distribute 56 kits with 6 volunteers. Here, we have something a little different to share, an obstacle of sorts. We had a heckler.
During one of our check-ins with St. Pete's, our volunteers told us a man in a blue truck drove by shouting at them. He called them enablers and a disgrace and said they were bringing down the community for introducing that stuff into the neighborhood.
As the last part, oh, I forgot to mention, our 200th dose was the West Virginia Episcopal Bishop. I think that's kind of cool. As the last part of our presentation, we'd like to train you how to use Narcan. And we do have kits available after if you would like to pick some up. It will be super easy. Jessie here, you want to wave your hand, Jessie? She's going to help us because she is also a trainer. The first thing you'll need to be able to do is recognize the signs of an overdose. These include unconsciousness, turning blue or gray for a person of color, and breathing very, very slowly. The first thing you must do is call 911. This protects you from any liability in the case that the person is not revived. If the person is sitting up, lay them flat on their back on the ground. Administer 1 dose up and out of the nose. This allows it to go towards the sinuses. Wait a few minutes, and if they are not responding, administer the 2nd dose that's in your box.
Most adverse effects associated with Narcan are secondary withdrawal symptoms. Narcan does not have the chemical makeup of other drugs that can cause allergic reactions. So once they come out of it, step back with your hands up. Inform them that they need to be supervised for the next couple of hours. Narcan stays in the system for 30 to 90 minutes. However, heroin can stay in the system for 6 to 8 hours, meaning a repeat overdose is possible even if they do not use drugs again. Narcan can be frozen and still be effective. However, if it gets too hot, it will go bad, so don't keep it in your car over the summer. A regular dose of Narcan is 90% effective. In 30 years, it'll be 89% effective. When we went to train people at the Huntington City Mission, we had a similar reaction from someone who did not approve of us using Narcan and said mean things to our volunteers. Our project has taught us both the value of human life and what it is like to give someone life-saving materials and teach them how to use them effectively. In our region, there is intense stigma and misunderstanding around the word addict and